So now jumping more into your public health and your work experience. You've worked in healthcare, community health, public health, leadership in various roles, as we'll talk about, and you've worked throughout the country as well. What does it take to move to a new place in the country and still be impactful and effective in your work?
For sure. First and foremost, it's family support. I could not do what I do without the support of my wife and my mother and my father, my entire family. Just being there every step of the way and creating space for me to have those early morning and late night meetings, and being able to provide at home for our kids and our family. Uh, just incredibly supportive, and I thank her for that. Not enough, unfortunately, but need to do more. Then integrating into every single community that I've been in. To me, it's a really important piece of public health, of leadership, of management. Do you want to make a difference in the health and safety of your community? I have tried in every single place that I've been, whether it's Baltimore, Washington, D.C., North Carolina, here in Montana, to really engage in the community in which I'm trying to serve. So that's either joining local Boy Scout chapter or the Chamber of Commerce, or engaging in a youth leadership community forum, the Lions Club or the Rotary Exchange Club, whatever that thing is for you to get engaged with your community has really helped me find a space and a place and build a network of people, colleagues, and just other professionals outside of the healthcare and public health realm to create better connections and to have a more meaningful experience wherever we were, right? And I think just my overall willingness to adapt. One thing I didn't mention in my intro is I'm an adoptee from birth. And my special superpower that I've brought from my own childhood trauma and battle with depression through adoption is really just adapting and trying to fit in and love where I'm placed. Giving love and accepting love, and having that ability to just get into the community and find what's there. I've also had to do a lot of unlearning in the past 6 years after I left the VA. I've unlearned a lot of bureaucratic management style and bureaucratic policies that the federal government likes to throw at you, right? It's a catch-22 sometimes, especially in this world of public health where we're very reliant on those federal dollars, and those dollars come with certain buckets that you have to behave in, right? But I also love being out in the more entrepreneurial way, just not a federal employee, able to be more nimble, strategic, and think about things a little bit differently, and still be a good steward of those federal dollars and this, regulations that come with them. So you've also got to understand, particularly in this new role here in Montana, the tremendous difference that exists between our coastal cities and our academic elite institutions on the East Coast and the West Coast to Middle America. And, we talk a lot about divides in this country, and I'll talk about that later too, I think. But there's definitely a difference in how you need to play in the space and how you need to adapt. What worked for me in Washington, D.C. and Baltimore City does not work in Billings, Montana.
That's important to know, especially in public health work. Like, one solution is one solution, but we need many solutions to come to the table. And especially considering that different places around just the US can be so drastically different in the assets that they have and the needs that they have and the capacities that they have. So definitely looking forward to hear more about that. But thank you so much for sharing all of that. And I'm glad to hear, like from the adoptee perspective, that you were able to learn from that, how to give and receive love, and how that kind of like shows up in your life as you've transferred into different communities, and like making those communities some part of your like your home and your family, which sounds like a beautiful thing.
For sure, for sure. And every time we've moved, or every time I've had a new role presented to me, yeah, I made sure that it was personally the right fit. And there were a couple roles that weren't. I didn't do a good job of that. But when I took this role, I made sure that I knew what I wanted to find, and I knew what I was missing. And finding the organizational culture, finding the team, finding the commitment to the community, all of those things that align with you as a job seeker. I knew that this was going to be a great fit and a special place just based on the interview experience, and how they brought the entire community in to interview me for 2 straight 8-hour days, and review that process. It was a place that I knew that I could be and live and work and raise a family.
I love that, and that just shows a lot. And I think it's important as public health professionals to build ourselves and get the skill sets and experiences that we want, so that when opportunities come our way, we can say, okay, we want to do this job because it provides the types of supports and the type of lifestyle that I want to live. Because I think too often we get dragged into a lifestyle that isn't something that we ideally want, and that takes a toll on our mental health, on burnout, and on all these different things. So it really is trying to position yourself into positions where you are fitting culturally and many things are aligned, so that you aren't like, it isn't that much like, of course work is going to be work, but it isn't going to be that much more challenging as it's going to be in an organization or in a place that just isn't a right fit for you.
For sure, for sure. My wife and I give ourselves a year when we've entered a new place, because we've really found that it takes that full year, maybe a year and a half, to find your people, to find your fit, to find things that you like to do, to find those hidden spots in the community that you're going to fit in and really enjoy. And as I've just passed a year in the seat here in Montana, it has proven true again. It's taken us about a good year to really feel like we're getting settled and we're in the right place.
And as I shared earlier, we met at one of the public health happy hours that I'm having. Definitely go register if you have not been to one as yet. And one of the things I highlighted in that happy hour, as well as like I think it's just important for public health professionals to know and to talk about, is you shared a story around having to convince the city council members of the importance of investing in prevention. Can you share more about this?
It was an amazing team here that has been chipping away at local community leaders, at city council and the mayor's office, and just educating and sharing data and sharing information. They finally convinced them to invest in our nurse family partnership programs and in an evidence-based approach to solving a problem in this community right now, which is safety and crime and violence. And we've found that, through NFP programs, I'm sure your listeners know this, that there are real impacts that if we can make in the early childhood programs, in investing in new mothers and new families, that we can reduce crime. We can reduce the likelihood of somebody ending up in the justice system. We can improve their literacy. We can improve their home life and create a supportive family environment. We can dramatically decrease the impact of domestic violence and other negative impacts on a family. And if we can reduce those negative childhood experiences and decrease childhood trauma, and improve the positive childhood experiences, it's going to have a societal impact. And having that conversation with elected officials who sometimes have 2 to 4 years in an office, they're not going to see the return on their investment in those 2 to 4 years, most likely. But we know that the data shows we can truly make a difference in this community by focusing on our kids, by focusing on our parents, our educational system, etc. And we've just shown time and time again enough data and enough information, and brought folks along in the conversation to and meeting people where they are. Meet your elected officials where they are. They could be totally against the work that you do in public health, for their own reasons that are in their own mind. And you just need to understand that and meet them where they are on that journey and ask them why they feel that way. And don't get defensive. Don't get standoffish and walk out of the room when they might be spreading misinformation or non-factual information, right? But let them share why they feel the way they feel. And then bring the facts, bring the data, bring the information, and bring the outcomes, bring the potential outcomes that they could see in their community. And bring communities of like size, like demographic makeup, so that they don't see, Billings, Montana versus New York City, or another unlikely pairing of cities, right? You've got to compare like to like. And then you bring them around that table and you build a relationship. It's just like harm reduction, right? You sit down and harm reduction strategies are all about relationship building and trust building. You've got to do the same thing with your elected officials. And the moment you say something or step out of line, and push them the wrong direction, you're going to lose that trust and you're going to break down that relationship.
Listening to understand, I think, is a big skill that we need to develop, not listening to react or listening to anything else, but just listening to understand. And then from there, as you're saying, meet them where they're at, get the data, the stories, create the education, show them the outcomes for where they're at, for the things that you understand from listening to them. But this is important work, and I'm glad that you were able to do this. And I feel like this is what we need more of around the country to ensure that we are investing in prevention, that we are investing into things that are going to help us in the long run to solve a lot of the issues and challenges that we are facing today.
Absolutely.